Von Willebrand disease is another coagulopathy that is basically due to the deficiency or impairment in the factor that is the von Willebrand factor. Now, von Willebrand factor is also very important in coagulation process as it is the part of our platelet cells as well as the endothelial cells of the vessels. Now, we will discuss that how the qualitative and quantitative deficiency of this von Willebrand factor is going to cause a disease and how it is going to affect the process of coagulation. Now, this is basically a diagram that is showing you this is the endothelial cell. This is basically the blood vessel. Endothelial cells are here, and this is the basement membrane. Now, these are the platelets, and these are the bodies, the WP bodies that are present inside the endothelial cells. Now, where the von Willebrand factor is present? Von Willebrand factor is present here in these bodies, or it can be present in the platelets. In the platelets, it is stored in the alpha granules, and whenever the platelets are activated from the alpha granules, this von Willebrand factor is released and basically perform its role in the coagulation and platelet aggregation. Now, endothelial cells that are present in the blood vessels, they are also involved in the formation of the von Willebrand factor. It is produced here, and from here it is stored into the WP bodies, and from that it is released into the plasma and basement membrane as well. So you can say that the von Willebrand factor is present in our plasma and it is present in the basement membrane. Now, whenever there is any injury or whenever there is any intravascular or endothelial injury that may lead to the damage to the endothelial cells, then what will happen that this von Willebrand factor, it will expose itself, and it will expose itself at the site of the injury, and this is basically the signal to the platelets. It will signal the platelets that here there is some injury and you have to come here and you have to form a blood clot here. So this is the initiation signal. The platelet will come and bind here at the site of the injury, and after that the platelet will be activated. There will be the release of the granules, and that will obviously release further von Willebrand factor, and there will be the activation of the fibrin that will basically cause the aggregation and formation of the blood clot. Now, another role of this von Willebrand factor is that it is going to stabilize the complex that is formed by the fibrin. So it is going to facilitate the fibrin in the formation of the whole blood clot, as well as this von Willebrand factor is somehow involved in the activation of the factor 8. That is also a very important component of this whole coagulation process. So that's how this von Willebrand factor is important in the blood clot formation, and whenever there is the deficiency of this von Willebrand disease, so obviously this whole process that you just have seen will not be carried out. There is no von Willebrand factor present here, it is deficient, no platelets will come here or will be activated or aggregated by the fibrin. Also, the factor 8 will be affected, its activity will be affected if the patient is deficient in the von Willebrand factor. So these all can be the circumstances in the patient who is suffering from this particular disease. Now, furthermore, if we talk about this disease, it is not the you cannot say that von Willebrand disease is a single disease. It is basically a heterogeneous group of the diseases. Almost 20 subtypes of this disease are known. Now, that means we are going to discuss about the different types of the von Willebrand disease. There are various classification systems, but here I'm going to discuss the one classification system that have been classified the von Willebrand diseases into different types. Now, first of all, there is the type 1 von Willebrand disease. Now, this von Willebrand disease is basically it is seen in 75% of the cases, and mostly it is the autosomal dominant trait, and it is quantitative. Now, quantitative means that there is the deficiency of von Willebrand disease that can be inherited or that can be acquired as well. Then there comes the type 2 von Willebrand disease. In the type 2 von Willebrand disease, what happens that there is the 20%, it is seen in the 20% of the cases. And it is the qualitative defects. Now, does that mean, that qualitative defect? It means that there is the presence of the von Willebrand factor, but it is deficient. It is dysfunctional, and its function is impaired. That is leading to the disease. Then there is the type 2A, that is the high, in which there is the higher molecular weight multimers are absent. Now, let me tell you one thing that I just missed, that this von Willebrand factor basically form the high molecular weight polymers, and that polymers then just break down in the plasma and then perform their role. So here in this case of the diseases, the formation of the high molecular weight multimer is basically affected. Then there is a type 2B von Willebrand disease, that is where there is the formation of the abnormal von Willebrand factor, and then there is the type 3 von Willebrand disease where there is the SWARE, and that is the most SWARE and the least common one, and the autosomal recessive trait, and it is the kind of the disease where von Willebrand factor activity is absent. There is the factor present, but the activity is not present here, like it is the qualitative defect, just like the type 2. Now, this is the type 2, and this type 2A and type 2B, basically they are the subtype of this type 2 von Willebrand disease, and both are qualitative, but here the high molecular weight multimer is absent, and in the type 2B there is the formation of abnormal von Willebrand factor that is dysfunctional, and it is not playing its proper role. So these are some types of von Willebrand disease that can occur in your patients. Plasma factor 8 level may be less than 10% of the normal in the patient who are suffering from the type 3 von Willebrand disease. Now, coming to the von Willebrand disease clinical features. Obviously, the patient who is suffering from a disease that is leading to the impairment in the blood coagulation, and that is leading to the excessive bleeding. So the patient may present some specific symptom that will distinguish this disease from the hemophilia, a disease that is also responsible for causing the excessive bleeding, and there is a blood clot formation deficiency there as well. So the patient may suffer with the mild bleeding diathesis, or there can be the immediate mucocutaneous bleeding, easy bruising, epistaxis, that is the bleeding from the nose. It can be seen in the patient who is suffering from the von Willebrand disease. There can be the GI bleeding, gastrointestinal bleeding, or there can be the menorrhagia and excessive hemorrhage after trauma. These can all be the manifestation that can indicate that your patient is suffering from von Willebrand disease. And also obviously some laboratory findings, they are important in such kind of the patient, and so that you can diagnose the disease easily, and you can also differentially diagnose this disease from rest of the coagulopathies.